Hello and good morning, afternoon, evening, everybody, because I don't know who will be watching this from around the world. And I hope there will be many people, because I think by now many people know Dr. Rhona Morrison and the wonderful book that she has written called I Don't Talk to Dead Bodies. So, Rhona, what I'd like to start off with is if you could do a short reading from your book.
Of course.
Something that you really feel would set the scene for us.
Okay, I think probably the prologue is as good as anything.
Okay.
It's only about a page and a half. Is that okay?
Yes, that's fine. Absolutely.
Okay. So, I don't talk to dead bodies. A ripple of laughter moves through the audience as I explain yet again that a forensic psychiatrist works with mentally ill criminals, not corpses in the autopsy lab. Actually, I did complete a diploma in forensic medicine, since so many patients and professionals expected some knowledge about bodies and crime scenes. But the image of a psychiatrist talking to a corpse is a million miles from the reality of my working life. Not everyone is suited to a career in forensic psychiatry. You need to be able to look beyond the offence and the newspaper headlines and see the person, hear their story, and identify whether or not mental illness is a causal factor. You must be able to remain non-judgmental and respect the person, even when they've raped a child or murdered a pensioner. Mental illness sometimes makes good people behave badly. My job was to find them, treat them, and rehabilitate them. Some might say, why bother? Just lock them up and throw away the key. But I wonder if those people would have the same opinion if a relative of theirs developed a mental illness and offended because of it. They might say, it wasn't them, it was the illness that made them do it. I suspect they'd want them to be treated and rehabilitated. The importance of valuing a person for who they are is deep-rooted in me and stems from my weekly childhood visits to my sister Vivian, who had learning disability, physical disability, and sensory impairment. She shaped my core values, my career choice, and how I relate to others. Having retired after 32 years in the NHS, I've had a chance to reflect on the highlights, the challenges, the inspirational people and bizarre encounters along the way. Life experiences are like pieces of a jigsaw that come together to make us who we are. Being born in a castle, learning what's important in life from my silent sister, meeting my husband in a gay bar in Belgium, associating with rapists and murderers, serving a life sentence in a female prison, that's another story, coping with a stalker, becoming a full-time carer, and navigating bereavement. All these events played their part in shaping who I've become. I'll stop there, I think.
Yes. As one of the questions I was actually going to ask you, Rhona, and it's already in, you already mentioned it. But I think one of the things that I have noticed throughout your story when I've been reading it is your immense sense of humanity. And that really comes through so strongly, your fairness, your justice, your desire to change the system, your desire to really want to make a difference. And the fact that you see mental patients not as mental patients, but as people, and the way you want to help them, not fix them, but just really help them. So thank you for reading that. I think our listeners will get an insight into your story from this moment onwards. So tell us a little bit about yourself. I met you in Edinburgh, and I had a wonderful time with you. Where you're from and the genre that you write.
So I'm Scottish. I'm a medical doctor, the same as a GP or a surgeon or whatever, but I specialised in psychiatry and then forensic psychiatry, as you just heard. I'm a widow and I have two children. They're both away from home. And I retired at age 55 as a doctor, which I could do as a psychiatrist. And I've since started an art business and written my memoir. So my genre is medical memoir, I guess. And that's me, I think.
Yeah, well, I think that's not quite you, is it?
Well, there's a little bit extra.
I think there's quite a lot extra. So, what is your book, I Don't Talk to Dead Bodies, about? Because there's a lot of medical information there that I think I had a big misconception about before I started to read it, and I have more clarity now. So tell us a little bit, yes, a little bit about that. So your potential readers will get to know and will be desperate to read more.
So it's probably easier to say what it's not initially, because when you say forensic psychiatry, we're people who give expert opinions for the court and murder and rape cases, that sort of thing. We work in prisons and deal with mentally disordered offenders. The majority of people who offend do not have a mental illness, and the majority of people with a mental illness, don't offend or are no risk to anyone. I dealt with a really niche market of tiny percentage of people who, because perhaps the voices in their head tell them that the devil is going to end the world, and they have to save the world by killing the devil. If the voices tell them their next door neighbour is the devil, then they may go on to murder their next door neighbour. Tiny proportion, but I had to look and find them. One, to treat them, because it's illness driven, but more importantly, to monitor them so that it doesn't happen again. And they should be going to a secure hospital rather than a prison. They still have a consequence, and we've got to keep the public safe, but they need treatment. So that was kind of my role. I've probably gone off the message in terms of what you were asking me.
That's okay, don't worry.
Remind me where you wanted me to go with that.
What is your book actually about? I don't talk to people.
Oh yes. So the purpose of the book was really, it's not an in-depth, look at a serial killer. If you're looking for that, that's not my book. My book's an easy read for the general public. There's lots of bizarre, funny, sad, scary stories in it, but they're all quite short. They're all anonymised. It gives you an idea of the scrapes that a forensic psychiatrist will get into. But the most important bit, which you picked up on at the beginning, was to give people a sense that these are human beings behind these sensationalist headlines. And the book is about the human beings and about making the reader challenge their assumptions and their judgments that they may have made. People who say mad or bad, lock them up, throw away the key, castrate them, that sort of thing. I'm hoping that it will stop you in your tracks and you will actually be forced to reconsider that position and be a bit more humane. Because it could happen to you, your brother, your sister, your husband. And if that was the case, I think you might want them treated differently than how some people perceive them at the moment.
Yeah, it's I think it's because we don't understand enough about the mental functions of our own selves, that when we do see people acting out of the way what we see is normal, we don't know what to do. We don't know how to say. I have a very, very small story. When I was 18, I was trained to be a nurse at King's College Hospital in London. And my very first day, I had to walk from my digs to the hospital. And as I was walking along, there was a man all scarred and badly bruised and talking to himself. And I didn't know about alcoholism. Can you believe I was so naive before I came to London from Hertfordshire? And he said, can I have some money? And I gave him some money. And I carried on walking into the hospital. And I happened to go into A&E. And a few hours later, he was there. And I was surprised to see him. So I said to one of the nurses, oh my goodness, it's God. Now he goes, this man is so badly hurt. I gave him some money. She said, don't you ever give him any money? Don't give them money. Don't approach them. Just leave them alone. I was quite shocked. I was so young and so unknowing. And since then, time has moved on, and I've seen a lot of people with alcoholism. But I would truly like to be able to think that, like you say, I am beginning to understand what mental health really means and what it really is and how we should approach and treat people.
Yeah, I mean, the people that I dealt with were very much one extreme, and there were public safety risk issues, security issues. I worked predominantly in the community, so when people got out of secure environments, they came back to the community. We had to support them and manage them, and so we were in their houses. There were sometimes samurai swords, just decorative, doctor, on the wall, and there were maybe drugs lying around and needles and things. And they might not be taking medication, they might be psychotic or violent. So we had to learn how to use our own sort of people skills. It wasn't all about diagnosis and take that tablet and you'll be fine. It was about holistic care. It was about making sure the environment was right. They had social contacts, that they had food, that you were checking the medication, were monitoring drug and alcohol use, getting support when there were issues. It was about the whole, holistic care,
Yeah.
but seeing them as an individual in a context and not just a diagnosis or a label.
Yeah.
But it doesn't excuse bad behaviour, and that has to be managed. But we didn't abandon people. We worked with the person despite what was happening.
Yeah, that came through so strongly in your book from the very beginning, from when you were a very young junior doctor all the way through to the end of your career. You were consistent in the way and your attitude and your sense of justice to all of the patients. You fought for your integrity. You fought that your integrity should be in place and that everybody should be treated humanely. And I think that's what I really like about you as the person, the doctor, and the way you've written the book. You really made it very clear to the reader that we don't dismiss people. We take care of them. We try to help them, fight them. And I really love that about the way, all the way through your story, that comes through. So I'm wondering about the title of your book. I remember when I first saw that and I asked you, oh, who did that design for you? You said, I did. I said, oh, okay. You said, because I'm an artist. Okay. But how did the title for that book come about?
When I was a senior doctor, often you had to lecture to members of staff and trainees, and trying to explain what a forensic psychiatrist is, a little bit like I read in the prologue. When you say forensic, people think scenes of crime, autopsy, CSI on the TV. And of course, it's too late for a psychiatrist if there's a dead body at a crime scene.
Yeah.
So the forensic actually is to do with the court and crime and the link between that and mental illness. Hence the court reports and the prison links and whatnot. So I used to say, I don't talk to dead bodies. That was something I would say in the lectures. It's quite kind of, just a bit out there. And so when it came to finding a title, I thought I need something that might catch people's attention.
Yeah.
And because that was something I actually said when I was lecturing, I thought I'll do that. Yeah. And then the publishers were going to get a graphic designer to do the cover. And my editor kindly said, Rhona's an artist, could she not do her own cover? Which was quite unusual, I think, for the publisher I was with. And they said, well, give us some sort of idea of what you want to do. And so pointillism is what the style of the picture is. It's done, the picture done with individual dots of ink. And that's one of the things I do art-wise. So I thought I'll do a criminal mind. So it's a psychiatrist's couch with a brain on it. Criminal mind. He's got little handcuffs and tackety boots. And so it kind of summed up. The book is hopefully quite amusing. There's quite a lot of funny happening. So I didn't want it to come across as an academic tome or an in-depth thing about serial killers, because it really isn't. And it's lots of funny wee stories. Hopefully they hook the reader, and then the destigmatization of mental illness message is woven in throughout the book. So, but hopefully it doesn't portray a very serious, dusty, dry book, because I hope it isn't.
It's wonderful, because it's a very serious topic that you actually handle it lightly, although it's serious. And I was going to mention a little bit later on that what I liked about your book were the little one-liners of humor that are peppered through the story. And I think it's what I call a breaking state, when you're reading something and suddenly you break state and think, oh, thank God. It's feeling getting, wow, that's a lot going on over there. So you can take a breather. And I really like that. The story I was going to refer to was when you'd had an accident and a policeman came along, and you were wearing a mohair jumper, and he just stood there stroking your mohair jumper, and he said, I could stroke that all day. You said, carry on, officer. From that intensity of what you'd gone through to suddenly that little lightheartedness, it gives the reader a chance to breathe, because I think what you have written, I hope when the more readers read your story, that they're going to get a very much more coherent and empathetic understanding for all the people around us who have so many problems. I know you are in the niche area over there. So a question I wanted to ask you, sorry, I've just got a little bit of a hiccup over here. So your story covers, I'd say, many important mental health issues, or the state of our NHS. And I wanted to just ask you, what has been for you the biggest changes that you have seen in your 32 years of being a forensic psychiatrist? Because I remember the early years when you wrote about it to by the time what were the most important changes that you've actually seen?
I think the impact of illicit drugs and alcohol, probably. Although they've always been there, they seem to be increasingly prevalent. And although my service didn't exclusively deal with drugs and alcohol, nearly everyone that I saw had an additional problem with some sort of substance misuse. Sometimes it was a form of self-medication to cope with residual symptoms, etc. But we did see a lot of it. But in the inpatient unit, it just became full of people who had significant mental health problems as a direct result of illicit drug use. It wasn't in my time, but spice was one more recently. And the behaviour and mental health issues that caused was horrendous for the person and for staff trying to manage them. They didn't respond to the normal treatments that we had, and people were getting hurt because they were fighting, and it's quite difficult. So there's just sort of the more traditional illnesses like schizophrenia, bipolar disorder, that sort of thing. Obviously, people with these illnesses would end up in the ward as well from time to time. But there was definitely a change in the mix of patients. It was becoming much more acute. And over time, the number of beds have reduced. So there's more of a pressure to turn people around or keep people at home, which for some people might seem that's great, manage people at home. But sometimes it's incredibly stressful for families. Someone who's behaving oddly, being irritable, perhaps aggressive or threatening, then a respite for both, I think, is important. And I think that was becoming more difficult as time went on because of the bed.
Yeah, absolutely. I wanted to ask you, can you describe what was the biggest influence in your life that led you to become the woman that you are today? What prompted you on your chosen career?
I think my sister Vivian, that again I made reference to in the prologue, I was the youngest of three, and she was in care from a very early age. She needed 24-hour care. She couldn't sit up, she couldn't hear, she couldn't see, she couldn't talk. She didn't grow properly. She had deformities in her body. And so she didn't really know we were there, but we visited her regularly. And when it wasn't my turn to sort of have her on my knee and jiggle her about, because that's how you got some reaction, I would go and speak to other patients who were verbal, and I just really got immense pleasure in just hearing what they'd been doing. And if you could get them to smile or encourage them to do something, it was just very rewarding. And I thought, I'd like to do something in the caring profession. And then when I got further on, some said there's a thing called learning disability psychiatry. So you need to train as a medical doctor first. So that was the route I took, and that was the plan. And when I passed all my membership exams in psychiatry and professional exams, you have to choose a specialty. And there were only 2 posts in learning disability, and they were full, and you couldn't stay waiting. So a job in forensic psychiatry was advertised, and I thought, what's that? Dead bodies? No idea. At that point, you couldn't train in it as a junior. You can now, but you couldn't then. So my tutor, the turning point, my tutor said, go to Carstairs, the state hospital at Carstairs, for a week. So it's a high secure hospital. He arranged it. I just left my job and went there for a week. And I went to visit Peterhead Prison. I went to Berlin to see someone who had been charged with murder. I met patients in the high secure hospital. And I'm basically nosy, and I was fascinated. And so I applied and I got it, and the rest is history. So I didn't really start out in that path, but I think it probably suits me quite well, because I'm not an academic. Obviously, I had to pass all the exams and things. I'm just not an academic. I'm a people person, and forensic, it's not all about academia. Yes, you use medication and you have to diagnose people, but working in the community, you were using yourself. You had to find a way of communicating and, de-escalating situations. You're in a house with someone who lifts a knife or a bit of furniture or threatens to kill the nurse that's with you or whatever. You have to be able to talk your way out of that, So it became, you were using much more of yourself, and I liked that. So relationships were huge, and we had people on our caseload for sometimes 20 years, so we knew them better than their own family. And we had to get them in our car and take them to hospital sometimes and have the discussion about, you're not well and you need to come in now, you know. So if they didn't trust you or know you, then that would have been a difficult conversation. So yeah.
And how old were you when you first started?
Well, I left school in 5th year, so that's, what would that be, 17 or something?
Yeah.
5 years at university, a year in medicine and surgery, 3 years in psychiatry, and then I started forensic, so whatever that is.
Yeah. No,
I did forensic for a long time.
Yeah. The reason I'm asking is, listening to what you had to do at such a very young age. I know that you use your intuition a great deal, and you said you weren't academic, but you had a lot of knowledge, whatever academia really means. I don't know with your amount of studying that you would have had to have done. But so here's this really young woman, and gradually, little by little, working with the people that you worked with is, I think, it shows. To me, I was just thinking, you are such a focused person. You kind of knew what you wanted to do, and you just followed that pathway.
Yeah, I suppose that's probably my personality, because you were alluding to the fact that there's other things about me. When I retired and I'd written my book, I wanted to do cruise line speaking, and I'm doing it. I've gone about it and done it. So yes, I suppose that's me. I got frustrated in the health service because people would always say, there's no money, they won't do that, they won't listen. So I decided I needed to become one of them. I became associate medical director very early on in my career. And I stayed that till I retired. So I was able to, argue to get £1 million to set up a new service or whatever. So rather than complaining about it, I think being part of the solution is quite important. So so that's my mindset, I think, is, glass half full, and then if you need something, you need to go and ask for it, and don't be frightened to ask, and go to the person that can help you.
Absolutely. And what has been the most important and endearing result of writing your book?
It's a good question. I don't have an answer for that. I think one, it's been really heartening how many people have actually bought it, and it's been out for almost a year now, and I've sold quite a lot of books. It's lovely when I hear, the other day I got a request for someone ordered a book from the United Arab Emirates, who's a trainee psychiatrist who was interested in forensic, and just the fact that I've heard people in Australia and America and whatnot. And that's lovely, and because you think I wanted to have a legacy for my career, and if it was to help destigmatise mental illness, then at some level, then I'm doing some good. And so the fact that the message is gradually getting out there, be it I'm doing talks on cruise ships to people from Japan and all that, or whether it's selling the book or doing local talks in libraries, whatever. I don't really mind. It's not about making money for me. It's about actually seeing if I can do some good, and I enjoy the social bit of it. So I'm happy to do the work, if you like. Not looking for a fee for doing the work. I just want to see if I can do some good and meet some nice people along the way. So that's the best bit, is the reaction, because it's been very positive.
And I think getting your message out there to, as you say, destigmatize the information that people have about your work, and then getting clarity and hopefully understanding. And I'm guessing, that as a carer or as a family member, it is stressful, because I think many of us now have been in that carer situation, looking after our family for all different kinds of reasons. So it's not an easy job at all, and not fully understanding what's happening and what are the consequences. So I think you spreading the word is going to do a lot of good for a lot of us around the world. The question I was going to actually ask you about that is, how do you feel knowing that people around the world have read your book, and what impact do you think it will have on them? You've answered that partly already, but and you've also answered, the question of, it's great having people from Australia and United Arab Emirates, but what does it make you feel knowing they're reading all around the world your story?
I just think it's a real privilege, really, to be able to share, a bit of knowledge or a bit of learning, I guess. And one of the things that was one of the first people that read it, a lady in my business group, actually, she got in touch, and there's a chapter in my book which is quite different from the rest of the book, which is about you had to do research as a medical student, and I'm just not an academic, and I don't want to do this. I can't possibly read, 1,000 articles on the treatment of breast cancer or something, albeit that it's interesting. I'm just not a reader. It wasn't for me. So I did some original research because there was no articles. I created it, so that was great. It was slightly niche. I came upon it by accident, but I was looking at low blood pressure and Down syndrome. And anyway, I did a study, and then I followed up the same people 10 years later. And so I created quite a bit of evidence that was unusual, that people didn't know. New information. Anyway, the lady in my business group has a son with Down syndrome, and she was reading it, and he had just transitioned from children's to adult services, and they had changed all of his medication because he said his blood pressure was too low. And she had just read my article, and she'd actually printed off the research article, and she said, blood pressure doesn't rise with age and Down syndrome. You found that. So there's nothing wrong with them. It's just how it is. So she took the article into her consultant, and they actually changed his medication. And she was so delighted. And I mean, that was just a complete random spin-off. I never expected anyone to be remotely interested in that chapter. But it was lovely that you hear these sort of little things, or people maybe who have. I was talking at a library on Monday, and I talked about my stalker, because that was one of the negative things that happened to me, having a stalker. And the lady in the audience had a stalker, and she shared that with us. And she got a bit upset hearing me talking about it. And then at the end she said, oh, you talked about how you dealt with it and everything. And she said, I feel a weight's been taken off me. And it was so lovely. Again, wasn't expected. So people all come at this with their own story. There might have been a family suicide. I talk about suicide because I reviewed suicide as part of my job for everyone in our area. So people have come at it and just got little nuggets from it, which has been quite unexpected, but nice when you hear that they've got something positive from it.
Yes, I think your story in the various chapters are going to touch a lot of people and give a lot of people, I think, hope and the possibility of a new way to live life as well. How will writing your story now affect the course of your life? That's a big question. Your life is still a long way to go.
Well, it's a bit of a spoiler, but the last chapter of my book, my husband dies. So people have told me when they're reading my book, they're laughing out loud at one bit and then they're sobbing at the next bit. But how did it change my life? Writing the book was what I did after my husband died. I wrote it. And the last chapter I wrote just weeks after he died. It's very raw, and we didn't change it at all. But what happened was, I said, that was the end of a chapter of my life, but the next one's going to be different, but it doesn't need to be a bad one. And so what's happened is that I've just absolutely embraced life. You don't know what's ahead of you, so you need to live it now. So my attitude has firmed up, not changed. I was always a bit like that, but much more so. I've been cruising for holiday for 20 years. I decided I was just going to keep doing it. I'll do it myself. And I thought, I like cruising, I like talking. I've now got a book and a story to tell. I'm going to pursue cruise line speaking. So I don't know what the future holds, but I was in Japan on a 5-star cruise lecturing earlier this year, and in September I'm off for 3 weeks on a 5-star cruise going to Vancouver, Alaska and Japan, doing the same again. And I'm in discussions with another cruise line at the moment as well. So I'm hoping that I get to spread the message, which is really important to me. But actually in the process, I continue to see the world, which I, adore. So I guess that's probably the sort of biggest plan, is to do that. I think. The other thing I do is Rotary. I was president of my Rotary club, and I think that's giving back to the local community, just with sort of charitable work and things. I enjoy that. It's a balance. Sort of doing that too. But
I want just on that little note, I wanted to just read something that you wrote, which resonated with me, and you actually mentioned it a little bit, but I wanted to reiterate it again. And I see endings as new beginnings, chapters of my life that I valued and learned from, but have now come to an end. And I really love that, because I think the way you have written your whole story, for me, it was filled with hope all the way through. You looked for the hope of helping people, and you were such an are such a positive person. It comes through. And I think that's what I really like about your story. It's such a special story. You focused, and in fact, you can show people how focusing one's life really helps one. The question I was going to ask you, which I think will end that question on, is how did you remain so positive? That's my feeling. For all the things that happened to you in all the chapters of your story. I remember the Mars bar and other stuff, but I don't want to talk about that too much. But it's more about, how did you cope? Because you saw so much at a very young age.
I think probably humour is one of my coping strategies, and I hope that comes across in the book. I've always coped with sort of negative stuff by trying to link it with a kind of funny or positive thing. And for some reason, it allows me to sort of hold the thing, but also move on from it. There's a story in the book about when my dad dies, and I'm trying to get to my father. I've just had a baby. I've got the baby in the car. The baby got abandoned in the car, and I had to get to the house. And the quickest route was over a privet hedge.
Yes.
The gate was only a few feet to the right, but the quickest route was over the hedge. And I had just had a baby, and bizarrely, it's a long story, pulled on a shell suit, dodgy. I pulled on a lilac shell suit to match the jumper, and it didn't fit, but I was in a hurry. My dad was having a cardiac arrest. So I tried to leap the privet hedge beautifully, but the tracksuit didn't. And I went splat in the mud, hit my hand off the concrete path, bleeding, mud, lilac. And I went into the house, and my dad had passed away, and everyone was crying. And my sister had to try and resuscitate him before the ambulance came. So she was really distraught. I was obviously upset, but afterwards, I just had this ridiculous hurdling incident in the lilac shell suit with the mud and the doctor ended up treating me. And I look back at it, I just think how ridiculous. The path was just over there. And it's, I suppose, sometimes I can usually find humour in it. And I think that's a medical thing, sometimes, black humour. You kind of cope with odd situations by not to belittle them or to minimise them, but it just in your head it kind of helps you. So
I know
that hopefully that explains. It's just a bit silly, but
I did laugh out loud at that, actually. So as we come to the end of this really lovely conversation, and thank you, Rhona, for joining us. Could you tell readers how they can obtain a copy of your book, please?
Yes, of course. I do have some signed copies, and they're on my website, which is www.rhonamorrison, as is on the screen, .com. So it's quite easy. And they're just for the UK, because the postage is too much otherwise. Otherwise, you can order it. You should be able to order it in any good bookshop, but the easiest place to buy it is on Amazon, and it's in paperback, ebook, and audiobook. 6.5 hours of me chuntering on in your ear. Feel the urge to do that. I speak more slowly on the audiobook because I know, as a Scottish person, I speak quite quickly. But I have slowed it down for the audiobook.
Thank you ever so much, Rhona. And I hope all the listeners have really enjoyed hearing about you, your life, the positive person you are, and the hope that you have brought to so many people, your colleagues and your patients, throughout your entire career. And wish you the very best, and have a fantastic journey when you next travel.
Thank you so much for having me.
Thank you so much, Rhona. Bye for now. Bye. Until the next time, everybody, when we will be having another lovely author in about 1 month's time. Bye for now. Bye.
Thank you.